This is only talks about knee replacements in these sessions. First of all, I would like to thank Rami for putting me in the program. Today, he asked me to tell about the new technology in knee replacements, whether it is a hype or a hope. This is my disclosure. We know that orthopedic surgery is the most dynamic specialty in medicine or surgery because it's a rapid advances, as a curative, life-changing operations is very innovative. But you know that rapid advances has a double-edged sword. When it works, it's patient benefit. When unexpected problem arise, patients may suffer. So the question now, where are we today with a joint replacement? Fact number one shows that long-term data on the current knee implant designs demonstrate about 90 to 95% success rates at 15 years follow-up. And is it hard to improve on 98% success rates and its chance that you may get worse? So if you look at this publication from Matthew Olivier, look at the conventional and the cast with a 10 years follow-up. That cast did not show any advantage in survivorship, functions, or quality of life. Well, Jung Hook and won this Children Award in a very prestigious Knee Society meeting last year, and he said the same: do not recommend widespread use of a cast in knee replacements. So Christopher Jones, he said there's some missing evidence of any conclusive demonstrations of clinical superiority. And very interesting, if you look here, that the cast usage in United States or Europe, UK is only 3 to 5%. While in Australia, registries look at here, that's increasing by up to 30.8%. So given the similarities of demographic, surgeons training, and another surgical aspect, difficult to elucidate the reason behind the big difference. This paper from Jess shows that what is the pro and the cons on robotic surgery, like system cost, operative time, learning curve, and soft tissue complications. And Alexander Chris shows here as well that he looked at the uni with a robotic, but remains to be seen whether robotic will improve long-term survivorship after a uni. Varus, in this last month publication, shows that he looked at 40 conventional and 40 robotic surgery and shows that the robotic decrease pain, improve early functional recovery, and reduce time to hospital discharge. While Brian Presley looked at the robotic as a brave new world, and he looked at the continued improvements, adaptability, and the cost reductions. So robotic surgery, according to him, will continue to evolve in the orthopedic field. Number two fact shows patient demand for a new technology that can influence selections. Because nowadays, it's direct-to-consumer marketing, it goes through the internet, and the philosophy that the latest is the best. So I start with one of the first in Asia Pacific back to 2004 and up to 2015. It is for my a good marketing tool that time. I'm still doing it, but in severe varus or valgus or in malalignments in femur and tibial. If you look at Michael Dunbar, he said, I cannot get no satisfactions after my knee replacements. If you look at the registry, shows that 20% still dissatisfied. And this is innovation in knee replacement technology has a little effect on satisfactions. Bob Bourne, again, look at the satisfied and who is not satisfied. You look at the implant types, there's no correlations between implants and patient satisfactions. Well, my good friend here, Stephen Howell, he said, no, the technique is important. So he said the recent modifications in implant designs and the surgical technique have not improved patient satisfaction. And he had some research with Dennis Nam. He should look at the use of a kinematic alignments, more patients reporting their need to feel normal. So when talking the EVORT in 2015, I think personally that implant developers have a strong influence in the published literatures. But however, more than 50% of the data sets are not reproducible in average patient's treatment, so should not be considered as the norm. We know positive result will get published quickly. Nobody gets promoted from publishing a negative study. Number 3 fact shows that new technology will increase costs, because a new and increased use of technology will add about 40 to 50% of the cost annually. Because a new technology is expensive while the reimbursement is declined, so we have to be very careful to analyze the costs and the benefits. Again, this paper from Fares Haddad shows that quandary whether the recent innovations such as custom cutting blocks, navigations, robotic and instrumented tibial insert make a difference that is worth in the investment. This from John Callahan. He said, surgeons should question when to adopt the technology and what their responsibilities are to their patients. If you look at the usage of the CAS in the United States from 2010 to 2014, about 38.3% decrease. How about the technology? Is quite difficult. Of course, as a high-volume surgeon, you don't use it quite often. And for the inexperienced and low-volume surgeons, now, because it's required a clear understanding of the goal of each step and required significant learning curve. If you look at the guidelines of the AAOS 2016, that surgical navigation and PSI has a strong evidence support not using intraoperative navigations. So we did some study and systemic review, just submit to the core, and we look at the survival rate of the ABN versus the conventional, not enough data published to support any functional benefit of ABN. And a further long study needed to evaluate the cost-effectiveness, clinical and radiological effect. Our current perspective is a good paper in 2018 from Go. It shows here that ABN and CAS group has a significantly improved mechanical access, but failed to demonstrate any advantages in clinical outcome following 2 years follow-up. How about robotic surgery? We know that it is quite expensive, but uncertain for the return of investment, and a long operative time, inability to perform soft tissue balancing. So I think the summary is that high-quality, low-cost generic implant will become available. Innovations need to be supported by evidence and not market-driven. And progress in healthcare requires publication of positive and negative results. So my take-home message are, there's no miracle out there. Basic and a good technique, soft tissue balance, and good judgment still the key. Thank you very much.
Thank you very much, Nico.